evening. There's been another rise in the number of people who have died from coronavirus in the UK as the government warned that this invisible killer is the biggest threat our country has faced in decades and that worse is to come. 563 patients have lost their lives in the past 24 hours, taking the total number of deaths in hospitals to 2,352 in less than 4 weeks. The latest increase in deaths is sadly in line with scientific predictions. Most of the cases are in London, but NHS England says the threat is everywhere, and a growing number of hospital admissions in the Midlands is now a cause for concern. Today it was confirmed that a 68-year-old semi-retired doctor in Hertfordshire has become the fourth doctor to die. He's our political editor. Coronavirus is so new that scientists are learning about it all the time, and there's still a lot of confusion about what it does to people's bodies. How much do we now know about what the virus does to us once we've caught it? Here's our medical correspondent, Fergus Walsh.
The virus uses its surface proteins, these spikes on the outside, to hook onto a docking point on the surface of human cells. After it is docked, the coronavirus is able to insert its genetic material, RNA, into the cell. Once inside, it hijacks the machinery of the cell nucleus to make multiple copies of itself. These burst out of the cell, destroying it, and then infect other cells. Now, for most people, their immune system mounts a response, and they begin to feel better after around 5 days. But in some, the immune system goes into overdrive and starts attacking the lungs and other organs as well as the virus. This can cause pneumonia and breathing difficulties and damage to other organs.
Fergus Walsh there. Well, our health editor, Hugh Pym, joins me now. A significant rise in the number of people who've died in the past 24 hours here in the UK, but we are being prepared for much bigger daily death tolls, even by the end of the week.
Well, that's right, Sophie. The Prime Minister said it was a sad day. Public health officials said it was concerning. Experts look at the trajectory, how quickly this death rate is actually growing. And one or two have pointed out it is very slightly slower than earlier in the epidemic. Even so, they're expecting the number of deaths to double twice in a week. That would mean the total number of deaths in the UK might hit 1,000 a day by this weekend.
The World Health Organization said tonight that almost 1 million people have now contracted the coronavirus. How do we compare to other countries around the world?
Yes, the global picture is very interesting. There's a chart that was shown at the Downing Street briefing, which we can look at now, based on the number of deaths once it had reached 50 in each country, where the line goes after that. You can see the red line there is the UK, just about where France is, and Italy, below Spain, but above China and well above South Korea in the number of deaths based on that. Now, experts say the number of deaths, very sadly, is what they look at to see how this pandemic is progressing. And here they say in a week or so's time, that number will be very important. Is it beginning to plateau, perhaps as a result of social distancing measures introduced in the UK?
Hugh, thank you. One of the hardest, cruelest parts of all this is burying the dead, and the fact that social distancing rules mean hardly anyone can attend a funeral now. Maybe 10 people at most, all 2 meters apart. Cremations are closed to the public. Only a small number of mourners are allowed at graveside burials. Some funerals are now being streamed online. Our island correspondent Emma Vardy reports. In France, 38 seriously ill coronavirus patients have been transferred by high-speed train from Paris to less overwhelmed parts of the country. The army helped to relocate the patients who have been moved to Brittany. France is struggling to free up space in life support units, and the situation has become critical in the capital, where the number of beds in intensive care units is now almost at the same level as the number of patients. The number of coronavirus cases in the United States has now passed 200,000. More than 4,500 people have died, almost half of them in New York State. President Trump has told Americans they are in the midst of a great national trial unlike any the US has faced before. Our North America editor John Sopel reports.
At this time of year, Central Park in New York would normally be getting ready for concerts and festivals. Instead, a massive field hospital is being built there to help alleviate an overburdened health system. In this state alone, there have been 2,000 deaths. America is shifting onto a war footing. This brought a dramatic change in tone from the president, now urgent and sombre.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, we're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
And if that didn't frighten the American people, this message today from the Vice President visiting essential workers surely would have done. He said that the US was on a path to follow the worst hit country in Europe.
We think Italy may be the most comparable area to the United States at this point.
For the first time in this crisis, Donald Trump and his senior medical advisors seem to be marching in lockstep. But one area where Washington seems at odds with the rest of the country is on testing, on vital equipment. Here, the president says that everything is under control. That's not what you're hearing on the front line. Today, exhausted health workers across the US have been protesting outside hospitals at the lack of protective equipment. And those working inside say supplies are running low.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
And we're running out of equipment in the hospital. Nearly everybody coming to the emergency department has this, and we're getting completely overwhelmed.
If New York is the foretaste of what's coming to America, this is what's ahead. In the money capital of the richest country in the world, a forklift truck outside a hospital lifting corpses into the back of a refrigerated lorry. John Sopel, BBC News, Washington.
In Italy, the stringent lockdown measures have been extended, although families can now take their children for a walk outside if needed. It comes as the death toll in the country climbed by 727 in the past 24 hours, which is slightly down on yesterday's increase. It takes the country's total number of deaths to more than 13,000. Of those, at least 66 are frontline medical staff. From Rome, Mark Lowen reports.
A glimpse of freedom in Italy's new normal. Parents are now allowed to take their children out for a brief walk if urgent. After 3 weeks of lockdown, it's a breath of liberty, but no more. Welcomed, albeit with apprehension.
Abbiamo paura.
We're scared to be outside and a bit spaced out because this lockdown has been our salvation. The measures are working. I'm happy they're in place and we want them to go on.
This eases the tension. We're not used to staying inside the whole day. We need some natural light, and children need some space.
The infection rate is slowing and there is perhaps a little bit more movement on the streets. But the fear is that if the restrictions are lifted too soon, people could get a false sense of security and then the numbers could start jumping again. Because Italy is still far from defeating this virus. Deaths are still soaring, and among them, doctors.
Gynecologist Roberto Miletti died this week, one of 67 doctors lost to the outbreak here. His friend says the deaths were preventable if medics had proper masks and supplies.
We're very shocked. He was much loved. And we're very angry because we're lacking protection equipment for doctors. We feel vulnerable. Wars must be organized during peacetime, not battle. We've been sent in empty-handed in Italy and around Europe.
We developed a valve. So young, inventive Italians have stepped in to help, using 3D printing to develop a valve that turns a sports shop snorkeling mask into a ventilator. The blueprint has been downloaded for free 1 million times by hospitals in need across the world.
2 days ago it was my birthday and I received a message from Brazil in which a doctor says me that 100 people were breathing thanks to my idea, and I was very, very happy. I cannot receive a better present for my birthday.
Italians are generally following the rules, but some frustration is starting to show. In the south, anger over a loss of money and closed shops. It's isolated, but patience has its limits. Today, the lockdown was extended to mid-April, so the emptiness goes on. Perhaps never again in our lifetime will we see Rome like this. The virus is sucking the life out of Italy. Mark Lowen, BBC News, Rome.
The UN Climate Change Summit, due to be held in Glasgow in November, has been postponed because of the virus. This summer's Wimbledon tennis tournament has been cancelled for the first time since World War II. The All England Lawn Tennis Club chairman said it's going to use the breadth of the tournament's resources to help local communities during this time. The Edinburgh Festival, due to take place this August, has also been called off for the first time in its 73-year history. The 5 events normally attract more than 4 million visitors to the Scottish capital. And the Champions League and Europa League have also been suspended until further notice, and with so many games cancelled, there is increasing pressure on Premier League players and managers to accept pay cuts. Both Newcastle and Spurs have applied to the government's funding scheme to help pay the wages of their backroom staff, but their first-team players on multi-million-pound salaries are still being paid in full. Katie Gornall reports.